Hey everyone, good to see you. Today I wanted to talk to you about how you can communicate with runners to share with them some of the benefits and potentially some of the cons to doing a running gait analysis. And this is a subject that you may not learn a bunch in school. School is really good at sharing things like how to assess a patient, or how to examine a knee, or an ankle, or a hip, or how to explain to a patient what you'll be doing during a physical exam, or potentially a manual procedure. However, school doesn't always give you the tools to be able to effectively communicate with patients to share with them the option of something like a running gait analysis. Now, obviously, there's a lot of people coming to see physical therapists, healthcare providers, and running experts. And of those people, they usually come for some type of physical limitation. Maybe they're not able to bend their knee, maybe they're recovering from an injury, or maybe they were running and got hurt. So for all those people, it's really important to share with them how to achieve the best clinical outcomes. And oftentimes, that means them participating in a running gait analysis. The problem is that a lot of patients don't know that a running gait analysis could be beneficial to them. They don't even know who does a running gait analysis. So it's your job to communicate with them, share with them the potential benefits, share with them potential downsides, share with them good talking points that you can make a conversation and you can make a decision together. So let me talk to you about some of the key parts of communicating with patients effectively to be able to convert them either into doing a running gait analysis or knowing that a running gait analysis is not right for them. And it really starts with listening before you speak. Because if you just start to speak at people, especially runners, people tune out. They don't listen for very long. Believe me, I know that if you just talk to people or talk at people, they don't listen. You need to have a conversation. And for someone that you're maybe trying to educate them on something that potentially could help them, first understand if it's beneficial to them. So the first step is to listen. And you've probably heard this quote in healthcare before. Listen to your patient, he is telling you the diagnosis. Now, while that's a very old quote by a very old practitioner, it holds some truth. Because in every patient interaction you have, no matter what, you've got to listen. If you don't listen, you're missing out on so much of the important information. You might miss that runner doesn't benefit from a running gait analysis. And then you educate them on all the benefits, only to understand it's actually not good for them and they shouldn't do it in the first place. Now, many athletes may have certain goals. And so their goals are very important to listen to. Their goal might be to reduce risk of injury. Their goal might be to run faster. Their goal might be to purely just learn about how they're running and the mechanics of how they're running. Or maybe they want guidance on footwear and shoe wear or corrective exercises that might help. Whatever it is, you want to learn what those goals are. And in that particular case, you want to then provide some education or provide some discussion points on how that patient or runner is going to achieve those goals. Now, when you are providing those talking points, and again, I stress the word talking because this is a conversation, not a lecture. It's really important to break it down for runners. Make it really easy for them to understand. It's so easy for us to get jaded with all this information we already know. We know about heel strike, forefoot strike, midfoot strike, terminal hip extension. We already know about how the gluteus maximus can be activated. We already know how to activate the gluteus medius. All these terms are like second nature to us. Abduction, adduction, flexion, extension, medial, lateral. We say that with ease because we already know the information. But we have to remember, for a lot of runners who are highly educated about running, they probably don't know about all the different language, especially as it comes to the analysis of someone's running gait. So break it down, make it very easy. Here's a couple talking points that you can use. And I have personally used these talking points for a long time. And I will tell you, I never feel like I'm putting the sell on someone. I tell them all the information to let them know what a running gait analysis can potentially, how it can help them. But this is not a lecture for them to say, yes, I need to do this, come, do the running gait analysis. No, not at all. So first, I always start with talking about their goals. So again, you want to listen first. We already talked about that. But then, after they have some interest and you've also decided that this is probably something appropriate for them, again, you'll find that out in this conversation, but this is probably going to be beneficial to them, then you want to break it down so it's really easy to follow. Tell them about how they're going to set up the running gait analysis. Here's my little spiel. First, we're going to have you run on the treadmill and video you in slow motion from the side and the back view. We also put special markers on your foot, legs, and body to be able to identify the moving parts of your body during the analysis. So they understand they're going to run, they understand that they're going to be on a treadmill, they understand they're going to get videoed, and that you're going to put some markers on them. Now, I've changed this over the years. Sometimes I'll use special equipment like wearable technology. I'll talk to them about that. Or I'll potentially talk to them about a certain functional measurement. I'll have them go through like the FMS. Or in the past, I've used other functional outcome measurements to be able to determine where they're at. So obviously, there's a lot of different things you can break down for them and tell them about. I'm just giving you the general spiel that I've given. And then describe the analysis you're going to do. Once your videos are captured, we analyze your slow motion running in real time by identifying, measuring, and taking a look at how much movement takes place at your ankle, your foot, your knee, your hip, and your trunk. This is when we'll identify specific correct or incorrect gait patterns, such as a heel, midfoot, or forefoot strike. And again, here I do use those terms heel, midfoot, and forefoot strike because it is something a lot of runners know about, but it also lets them know that there's specific key things that we're looking for. We're looking for the way their foot lands. You could also maybe talk about if they're a patient or a runner that's having knee issues, we're looking at how much knee flexion or knee extension you have, or how much bend in your knee. These are not set in stone talking points, but they're obviously ones that have worked in the past. And then move on to talk to them about the deliverables they'll get. When I say deliverables, the things they're going to get when they come, what they will leave with. This is the stuff that they are going to take away from their gait analysis. After your gait analysis is complete, we may or may not perform other tests, such as muscle strength, range of motion assessments, or special tests. At this point, we will discuss a plan to correct your running, including specific corrective exercises, form changes, and footwear recommendations. You will also receive a written report of your analysis along with the videos of you running. Now, that's the first part of the conversation I have, and it guides the next section. But before I get to the next section, I want to stress again, this is a genuine conversation. You're talking to this patient or this runner about a good, potential beneficial analysis they can take part in. This is something you offer, and it specializes your offerings because you offer this and help them achieve their goals. So if they say, well, can I just do traditional PT to get these results? Almost always, I will say, yes, you might be able to get similar results by doing traditional PT. The running gait analysis may give us some more information that could help us achieve your goals. Or in some cases, I'll say, I really do need to figure out how you're running. If you don't want to do the full-blown gait analysis, I might just be able to at least take a slow motion video. It won't be a full analysis, but at least I can have an idea of how you're running. Now, I don't really like to offer that very often because I do think there's a lot they miss without doing the full gait analysis. So, it's only really if patients can't do the full-blown gait analysis that I'll say, hey, let me just video it and at least look at it in slow motion. Again, I talk to them and educate them about the differences between the two, and they can make the decision that works best for them. Also, again, this genuine conversation you're having, it's really important to, again, talk with them to determine if this is something good for them. Is this something that is beneficial? Will this help them reach their goals? Well, in my opinion, a gait analysis is going to help identify the way you're landing, and that can help us diagnose whether that hip is being re-aggravated by potentially some overstriding or your foot landing in front of your toe. So you're talking to them about how this gait analysis would help them achieve their goals, if applicable. It may not. You know what? In this case, I really think it was a one-off injury. Your knee issues aren't really aggravated by your running, at least as far as I can see. We don't know until we really look at the way you're running. However, I don't really think a gait analysis is needed. If it's not something you're interested in, I wouldn't worry about it. So again, that's a genuine conversation. you don't really want to pressure the patient or runner in any one direction. It's their choice to do whatever they'd like to do with their health. However, I always like to continue these talking points by asking if they have any questions. What questions do you have about the running gait analysis? Do you think this is something that would be helpful to you and beneficial? Almost always they say yes, I think it would be beneficial or helpful. Oftentimes they'll ask about cost. You're welcome to talk to them about the cost. They'll oftentimes talk about whether it's covered by insurance. Me personally, no, it's not covered by insurance. That's however you want to organize your gait analysis, although I do think that for the time that for what you're going to be reimbursed by insurance, it's going to be really hard to provide the time needed to do a gait analysis. And then lastly, asking if there's any part that they don't quite understand. Would you like to see a demonstration of what's going on? And I've pulled out my iPad before and I've showed them some demonstrations. This is stuff that I have HIPAA compliance for and everything like that. So you have to be a little careful there. But, I'll show them the examples of it so they can see. And then lastly, I'll, work out the schedule with them. So, as far as scheduling a time, there's a couple different ways you can do this. This is depending on your operational setup. But if the runner's interested in scheduling a running gait analysis, running experts do have a choice. They can personally schedule them or ask their schedulers to do that. Now, I like to do it a specific way. It looks like I have a time on XXX date at XXX time that would work for you. Would that work for you? Great. I'm going to have my admin, Tyler, put you on and make sure that you can reserve the time before anyone takes it. And let me walk you up there to make sure that you can get that time. And I'll walk them up there so they can schedule the time. That's worked for me in the past. Also, sometimes I'll say, make sure to just schedule it before you leave on your way out. Basically, I will tell them when I want them to get it. So I want you to get this 4 weeks into your treatment plan or 6 weeks into your treatment plan, or at the very end of your treatment plan, maybe that's 8 weeks or maybe that's 9 weeks. Whatever it is, I want you to get it on this specific time and date because that's going to be most beneficial to your outcomes. Now those are the end of my talking points, but I'm going to say a couple more things. Really, I think in this case, PTs are truly sitting on a gold mine. You see a lot of patients that run most likely, and to find candidates for a running gait analysis is not a stretch. There's a lot of runners that would benefit from a running gait analysis. And you already have rapport with these patients, you already have trust, and it's something that genuinely will help them achieve their goals. So the key factor here is taking the time to educate them about it, listen to them, talk with them through why it might be beneficial, and then let them decide whether this is something that would be beneficial to them or not. But if you don't educate them on what or how to do a running gait analysis or how you're going to do this gait analysis, they just think that it's no different than someone watching them run at the running shoe store and that is going to be their gait analysis. And they think to themselves, well, why would I pay for that? Or why would I spend extra time doing that? What do I get out of this? They don't realize that they're going to get a full report. They don't realize that they're going to get all this information. And that's part of what we talk about in the Essentials of Running Gait Analysis Continuing Education course that's available. We do go over a lot of the detail about how you can talk to patients, how you can set them up, how you can explain to them the benefits of a running gait analysis if it's applicable. Again, how we get those runners to achieve their goals is our job. That's where running experts and running specialists come in, is to be able to help those runners achieve their goals. So, if you haven't already, take a look at the course, or if you've graduated already, great job, we love it, and we're hoping you're doing some successful running gait analyses. In the meantime, we will look forward to seeing you next week, and we'll look forward to talking about a new subject, so stay tuned. In the meantime, stay safe.